Now let's turn our attention to the patient section of ACE. As we refer back to our workflow, we see that our patient has changed to a status of active patient-new. If a patient has this status type for more than 2 weeks, the therapist will receive an alert indicating that they need to report to the admin group why this patient still has this status. Patients should never remain at this status forever. There are a number of reasons why they may be there though, but it's not a permanent arrangement. Within ACE's patient section, the following patient status types exist. Active DDS is a patient that will be seen for a DDS evaluation or has recently had a DDS evaluation completed. Active patient-new is a patient that has recently been assigned to a clinician. Active patient is a patient that is currently being seen for therapy. Inactive DDS is a patient who was scheduled for a DDS evaluation but did not complete the evaluation. Inactive patient is a patient that is not currently being seen for services because services have been temporarily put on hold. Discharge pending is a patient that has recently been clinically discharged by a clinician. Discharged DDS is a patient who has had a DDS evaluation completed and submitted. Discharged patient is a patient that has been both clinically and financially discharged from the practice. Record sealed is a patient file that has been sealed due to adoption. Any status types with a red asterisk indicate that an assigned clinician can see these patients on their patient list. When the therapist receives the inbox notification about their new patient, we are asking our therapist to either do an evaluation or plan of care or possibly both. When the therapist documents their evaluation and plan of care, they do so on their device. But how do they get that information to us? They sync their device. So what does it mean to sync? Simply put, syncing is what allows all users of the ACE system to have and see the same data. In this picture, you can see that a therapist has done an evaluation and a plan of care. She has grapes, but the company doesn't have the grapes because she hasn't synced her data. By the same token, if we administratively have added anything to ACE, such as a new patient or oranges, she can't see that either. When a therapist syncs their device, and that's the only time they need an internet connection, everyone then has the same data. The best ACE policy is to daily sync, blink, and roll. That means users or clinicians should sync at least every night while their device charges, and then roll on as they do therapy the next day. If we do not see something in ACE, such as certain documentation that we're waiting for, it's possible that either the user has not done it or they have not synced. In the staff section of ACE, you can open a staff record to pull a last synced report. After the user syncs, the evaluation and plan of care they did are submitted for review to the clinical group. Keep in mind that the review feature can be turned on or off per therapist. So if this isn't part of your company's workflow, you can choose not to implement it, and that's fine. It's a feature that's set on a staff record, so you may choose to implement it only for certain staff members. That's just up to you. If your company is choosing to do reviews, the review request is sent to the clinical work group. One of our clinical reviewers will then accept the task from the work queue. Notice this pattern because this is the exact same pattern that you will use to accept all tasks from any work group. When the user accepts the task, it will automatically be transitioned to their individual inbox. Next, the user opens the request for the review, and the message contains attachments to the documents. The user can then click the Evaluation button, because this is the piece of documentation that was submitted for review. Once the attachment is clicked, this form will appear. The top portion of the screen shows the user's documentation, and the bottom portion of the screen is where compliance notes are typed. Administratively, we do not have the capacity to change or edit therapist documentation. We can tell them what types of changes need to be made prior to signing it. If the review is complete, the user may click the Document Review Complete button. If the user wants to save the review and come back later, they may click the red button. If the user wants to make the documentation go through the review process again before it is signed, the user needs to click the Needs Additional Review checkbox. Once the document review is marked as complete, the therapist will then receive a message indicating that the review of these documents is complete and that there are changes that need to be made prior to signing it. Remember, they must sync to get these documents and this review back to them. The user will make the changes and sign the documents, which automatically places the documents in the patient's EMR. Once the plan of care is signed for any patient that has an active patient-new status, the administrative group will receive a notification so that they can act appropriately. If the patient has a Medicaid funding source, the therapist will immediately receive an inbox message and alert that an initial authorization questionnaire is due. The clinician will then go and complete the small questionnaire, which asks questions requested by funding, and then they'll sign the questionnaire. Let's discuss the process for how to handle initial authorizations. The first step in this process is to click the button for Inbox, and then to navigate to the work group for the administrative group. From the administrative work group, the user should accept all messages for authorization questionnaires, including reauthorization questionnaires and new POCs. The action of accepting these messages from the work group will automatically move the messages into the user's private inbox. At this point, the user's inbox essentially becomes their task list. Open a message regarding the active patient-new having a POC and determine if the funding source indicated on the message includes Medicaid or Health Choice. If the funding source includes Medicaid or Health Choice, there should be an authorization questionnaire complete message for the patient as well. If you see the corresponding authorization questionnaire, the new POC message may be deleted. Next, open the message regarding the authorization questionnaire being completed. Use the patient attachment to navigate directly to the Authorization tab of the patient record. Click on the button for the Authorization Request form. This form may take some time to load because it's pulling data from so many different areas of the program. Be patient. Once the form loads, the user will copy and paste the data from the authorization request form into the Choice PA website. When the user has completed the request on the Choice PA website, the user should enter the requested date into the row for new Medicaid authorization. To avoid data entry mistakes, which can happen easily, use the Date Picker Calendar feature when inputting the date. Once authorization is received for the patient, enter the received date, begins date, ends date, and visits approved into the new Medicaid authorization row. Next, click the Send Alert button to notify the treating therapist of the approved authorization. Once the alert is sent, the user will receive confirmation via a pop-up. Next, the user should index the authorization PDF document into the patient's EMR. The user may do this by clicking on the EMR tab of the patient record and clicking the Index New EMR button. The user will then use the Browse button to locate the authorization approval document. The user should enter the document type as Authorization. Enter the appropriate document date, begin date, end date, and any appropriate comments. Finally, the user should click the Save EMR button to add the document to the patient's EMR. Finally, the user should change the patient status from Active Patient-New to Active Patient. They may delete the original inbox message regarding the authorization questionnaire. Once a patient transitions to a status of active patient, the green light is on and treatment can begin. Active patients can, of course, be found in the Patient section of ACE. When a referral is transitioned to a status of Active Patient-New, the patient is automatically assigned a patient ID number, which corresponds to the billing software. As we go through the patient section, we're going to identify which information is being populated by the therapist data. One of these fields is primary language. Every time an evaluation is done, a clinician is asked to indicate a patient's primary language. This field is then updated with data. Also, the clinical discharge date field is one that will only be filled in when a therapist does a discharge summary and indicates the date of discharge. Think of these as one-way streets. The information can only come from the therapist. We cannot change these fields. Now, anytime a patient has a phone number change or an address change, their therapist will notify the administrative staff to make these types of changes. Throughout the ACE application, you'll notice that there are fields that contain a history button with them. This allows the user to see the history of that field along with begin and end dates. On the Authorization tab, this is essentially the place we see all dates related to the patient. Plan of care dates will only be entered by our therapist. Anytime a therapist signs a plan of care, these current POC dates will update. Any visit remaining fields will be updated based upon the number of visits completed by the therapist. Also, the authorization request form is updated each time a therapist does an initial authorization questionnaire or a reauthorization questionnaire. All evaluation begin and end dates are based upon when a therapist does an evaluation. They can also be entered manually if it's another provider evaluation. The program will automatically calculate a year as the end date, but the therapist may do an evaluation sooner if needed. The Service Details tab shows the place of service addresses and diagnosis information. Place of service addresses can be added and the primary can be changed by either the therapist or administrative users. The administrative users will receive a notification of any newly added place of service addresses so that they can add the ZIP +4 since the therapist will not have the ability to do so. All diagnoses are entered into the system by therapists and are based upon their diagnoses in the evaluation, but these can be changed administratively. Anytime a diagnosis is changed, the billing group receives a notification. As we've discussed previously, the Funding Source tab provides us with the funding information for the patient. Since funding sources do change, we also have a history of that, along with dates. In regard to private insurance, we have areas for multiple insurance information. By clicking on the additional insurance information, the user will see this form. This form not only contains the very detailed insurance information, but also the verification of benefits that we do for the patient. Whenever all information on the form is verified and complete, the user will click the Complete button, which will do two things. 1, it will lock the form to prevent other changes, and 2, it will send a copy of this insurance information to the patient's EMR automatically. Anytime the information needs to be updated, the user will click the Update button and then complete once all changes have been made. On the Physician tab, we see the patient's treating physician and the physician that has signed the order. The user may select the physician from the drop-down menu, but it's populated based upon our physician's records that are set up in the database. Every time an evaluation is signed and sent to the EMR automatically, the ACE program will then automatically fax the evaluation after hours to the fax number associated with the physician. Anytime a new physician order is received and that date is entered, the billing group will receive a notification. Encounter notes for the patient are extremely important, and all administrative employees are responsible for entering them whenever they have an encounter with the patient or caregiver. The largest function is to know inter-office what is happening with each patient. To enter an encounter note, the user simply needs to click the Add Record button. This will cause the form to appear. It defaults to today's date and allows the user to enter a contact name and then a summary of the encounter. Some of our users will copy and paste emails from a therapist related to the patient. Encounter notes tell our administrative story, from referral to discharge. I cannot state how important these are. Please use them. The Referral Placement tab obviously allows us to see where the patient was referred from. This form also allows us to change the primary treating therapist and the secondary therapist that can view EMR documentation for the patient. The timing of changing therapist is critical. Once a therapist is changed, the previous therapist does not have the ability to do documentation or to view the patient's EMR. Due to this fact, the previous therapist also needs to make sure that they remove all future recurring appointments from their schedule prior to their transition. The EMR tab within a patient record limits your EMR search results to just display for the patient in question. It is also quite ideal for indexing a number of scanned paper documents to prevent errors and misfiling. When indexing a new record, a user can select a single record, such as a 3-page CDSA evaluation, or a batch of documents. Say 2 pages are an insurance form, 3 pages are the evaluation, etc. It simply lets the user divide a bulk of documents and index them within the application. All documentation created by a therapist is automatically indexed to the EMR once it is signed. The only documents that we index manually are ones created outside of ACE. At the referral level, think of forms such as consent forms or other paper documents. All automatic fax communication is also shown here. A therapist cannot view all EMR information. Any document you see in this list with an asterisk is one that cannot be viewed by the therapist. Additionally, a therapist can only view the past 13 months of EMR documents for each patient. This really serves as a HIPAA protection, so that if the device were ever stolen, although the devices should be encrypted, only a limited data set would be at risk. If the therapist needs something outside of that, they can request it from medical records. Patient reports can be accessed in the Patient section by clicking on the Patient Reports button. Just like all of our reports section, the reports are created by going from left to right, top to bottom. Keep in mind that these reports can also be exported to Excel by clicking on the Export to Excel checkbox before running the report. Obviously, there are lots of patient reports, all of them serving different purposes. One of the interesting ones is Active Place of Service Google Map by Therapist report. We can select one or more therapists to run the report for. When we run the report, ACE will open a Google map that displays the place of service addresses for each of the patients for this therapist. If there is more than one therapist selected, each therapist will have a different color pin or type. Additionally, there is a red house pin for the physical address of the clinician. We're trying to make sure that everyone is working efficiently. When the map is open, the user may hover over each patient pin, and it will show the therapist name, patient name, and the place of service name and address. This concludes the instructions related to patients and initial authorizations in the administrative portal of ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written administrative ACE manual for detailed instructions and screenshots related to specific features and tasks.